Glioblastoma is brutal. It weakens your body, it takes your speech, even your memories. It's persistent. It spreads with finger-like growths, so it's very difficult to remove, and radiation is rarely effective. But most of all, it's fast. The average survival time after diagnosis is only 14 months. For most people, that's just one more birthday, one more New Year's Eve kiss, a handful of moments to love and laugh and say goodbye. Bonhoeffer, a theologian, once wrote, "Time is the most precious gift in our possession, for it is the most irrevocable." Of all the things that cancer steals from us, strength, mobility, comfort, and memories, time is the cruelest. The days spent in treatment or recovering from surgery, anniversaries and Christmases, long phone conversations and short summer nights, pages and pages of our photo albums unfilled. Our time with each other is precious and irrevocable. That is the urgency of now. We can't afford to wait another minute for better solutions, better treatments, better cures. And that's why we're all here today. I don't have to know you to know that your life has been touched by cancer. Maybe you've sat bedside with a family member who has struggled through treatment. Maybe you've lost a friend too soon. Maybe you've offered up prayers for someone in your church, mosque, or synagogue. Maybe you're a survivor yourself. We are here today because of what's at stake, because we are all searching for answers, because we dare to believe that together we will beat this. Thank you for joining us here today. We have people participating in this summit from all over the world. Some of those in this DC audience are Josh Perry from Raleigh, who survived a brain tumor, who now uses his pro BMX and stunt background to raise awareness. Sarah DeBoard, a colon cancer survivor, who teaches young adults about the warning signs. Mike Paradowski, a cyclist who after overcoming head and neck cancer, now rides 500 miles each year to raise awareness. Joe and I are so grateful that you are all here with us today. We were so proud when President Obama asked Joe to take mission control of the White House Cancer Moonshot in 2017. But when the administration ended, we really hadn't planned on launching a cancer advocacy organization. But many of the leaders we worked with through the Moonshot told us, there are incredible organizations in this space. They are doing good life-saving work, but there's still a need for someone who can bridge the gaps. Cancer experts, friends, and colleagues recognized Joe's unique ability to convene, form collaborations, and hold people accountable. We felt a moral imperative to step up, and we were honored to be joined by a world-class board of directors and advisory council. They've done tremendous work, and I'd like to take a moment to thank them. Together, we've been hard at work on improving data standards and helping patients share their data, reducing disparities in cancer outcomes, calling for greater access to patient-centered clinical trials, and changing our culture so we can make the best use of investments. Today's science has us at an inflection point in cancer, and we must seize this moment. I was in my early 40s when a close friend of mine named Winnie was diagnosed with breast cancer. Soon, another friend confided in me that she had breast cancer as well. Then another, then another. In 1 year, I watched 4 friends face down cancer. 3 of them survived, but Winnie didn't. I couldn't forget the looks on the faces of her children. Winnie's death motivated me to get more involved in this cause. I hated knowing how many women would die because breast cancer was something that was only whispered about. So I went to what I knew: education. In 1993, I started the Biden Breast Health Initiative. We wrote a curriculum for girls in high schools about self-examinations and prevention. And over the next few years, we visited every high school in the state of Delaware. In the 25 years that I've been working on cancer, a lot has changed. Thanks to many of you here in this room. In fact, according to the American Cancer Society, the cancer death rate has fallen 26% from its peak in 1991. Yet, as you all know, progress is uneven. Rural, Black, Latino, and Native American communities all see far fewer positive cancer outcomes. Poverty draws a line between surviving and succumbing to the disease. Cancer is the second most common cause of death for children up to age 14, and cancer rates for this age have actually increased over the years. While earlier diagnosis, precision medicine, and immunotherapy have revolutionized the treatment of certain diseases, many cancers still remain as deadly as ever. And though improvements in diagnosis and treatments can change the statistics, individuals still struggle to understand and cope with the complicated medical environment. Patients and their families too often feel overwhelmed by medical jargon and treatment options. They feel alone and confused by the complexity of the very healthcare system that is there to support their journey. All of this is not for lack of trying. There are wonderful organizations doing incredible work in this area. Many of you are part of these organizations. But the gap that exists between scientists, patients, advocates, and nonprofits are still untenable. Despite decades of research, billions of dollars in funding, and the best minds in science working on this issue, there is still no word as frightening as malignant. But all of these advancements only matter if they actually improve lives, your lives, the lives of your family and friends. That is the guiding principle of our work at the Biden Cancer Initiative. We're bridging the gaps in the cancer network. We're working to provide resources, improved outcomes, and just as important, provide hope. What does that all mean in practice? Right now, if we stopped all the research entirely, if we never spent another dime on finding new cures, we could still save thousands more lives by doing one thing, breaking down the barriers between the various branches of this movement and sharing the knowledge that already exists. Over these last few months, I've convened community dialogues around the country with family members, nurses and doctors, patient navigators, and other care providers to share their perspectives on the cancer journey. Through these conversations, we've heard about the realities of living with cancer, ways to support caregivers, and how navigation impacts and drives outcomes. That knowledge has informed our Biden Cancer Collaborative, a platform that brings patient and advocacy organizations together to develop solutions to these problems. Our hope is to use this collaborative to develop a roadmap to navigate this disease. Today's summit is about sharing, finding solutions, imagining a better way to redesign the cancer experience. Today, we will hear from speakers across sectors, disciplines, and backgrounds who are connected by the cancer experience. We will explore solutions to some of the most complicated problems and challenges standing in the way of progress. We'll listen, learn, and hope together. Across the country, conversations are occurring in nearly 450 community summits. In each one, individuals are coming together to contribute what they can to solve the problems facing cancer patients in their communities. And throughout the day, you'll hear about the public and private sector's commitments regarding cancer. For example, it may not be obvious what the sharing economy has to do with cancer, but as you will hear this afternoon, Airbnb, WeWork, and Lyft all found ways to support this effort. But it's not just big groups, it's individuals who are making a difference as well. During one of my visits to Portland, Oregon, I met Krista Nelson, an oncology social worker who is here in the audience today. She told me about a young cancer patient whose treatment was working, yet while he was recovering, he was losing weight. He eventually confessed to her that he was on a very fixed income. He lived in a modest apartment with no real kitchen. He had a hot plate that he used to cook, but it had broken, and he could only eat food that didn't need to be cooked. So Krista helped him replace the broken appliance, and his recovery got back on track. When we think about the tools to fight cancer, not many of us would include hot plates. But to this young man, that's exactly what he needed. Everyone has a role to play. So go to your strengths. What can you bring to this cause? As advocates, doctors, scientists, survivors, and loved ones, we are counting on you. Now, as you all may know, my other job is being an English teacher. So unsurprisingly, I'm going to end with some poetry. In 2007, a group called the Cancer Poetry Project put together an anthology of poems written by survivors as well as their loved ones and caregivers. Here is a line from a poem in the anthology by Nancy Louise Peterson, a breast cancer survivor, whose piece was about reading bedtime stories to her young daughters. She wrote, "I need to tell you, I've learned both at the same time that time is limited and it's never too late. Our time together is precious and irrevocable. Getting this right for patients, for their families, for our entire community, ending the reign of terror this sickness has held for so long. This is urgent, but it's not too late. Together, we are stronger. We are fiercer. We are more powerful than this disease. We can save lives. We can protect those birthdays and anniversaries and New Year's Eve kisses. We can keep our time with each other if we act now, if we start today. So thank you. Thank you for being a part of this summit. To our medical professionals and researchers, thank you for the revolutionary work that you do every single day. To the family members and the caregivers, thank you for your incredible diligence and fortitude. And to the patients and survivors, thank you for your courage and your hope. Joe and I are with you every step of the way because it's about time we created the kind of cancer support network that Americans deserve. It's about time we gave the fierce, courageous, relentless survivors a chance to share their victories. It's about time that we said, not one more mother, not one more grandfather, not one more son. It's about time. This is the urgency of now, and together, we will fight for the most precious thing we all have, time. Thank you.
When you drive in to the Navajo Nation from the south, there's a scenery that just really kills me. There's all these huge power lines, but half the people underneath it don't even have power. Right now, there is no cancer treatment on any native land, but we know that we're sending at least 5 to 10 people off every month. Where we are, Tuba City is about 80 miles north of Flagstaff. We have patients that just say, you know what, I can't even get treatment because I can't afford the gas. And then by then, sometimes it's already spread. So that's where we need to make it to where they can just come in, get their diagnosis, and know that we're right there in town.
Native Americans are some of the most underserved minorities in the United States.
Our cancer center will be the first
on a Native American Indian reservation.
We'll be able to give the chemotherapy, we'll be able to give the psychosocial help, the care that is what patients now have to drive off the reservation to Flagstaff to get.
Our physicians, Dr. Chow and Dr. Demento, said, Lynette, if you get a program going, we'll come back. We were able to get into the Fighting Cancer initiative, and it's one of the best things that could have ever happened. A lot of our Navajos are traditional. Having your family sit with you at these treatments, being able to have traditional prayers when you need them and not have to be able to leave, and they can look out over the land and really make it comfortable for them. One of the most important things is somebody speaking to them in Navajo. And hearing Navajo while you're getting treated, something to make their whole mind and body and spirit feel good about their health care, we will encourage that.
People are dying from cancers that could be curable. And the Fighting Cancer Initiative has put cancer and treating and fighting cancer on the map that I don't think has happened in decades. As a team, we're going to make a difference.